Good afternoon, everyone. Thank you for joining us for this webinar. My name is Samantha Peck. I'm the Director of Communications and Education for Family Councils Ontario, and I'm going to be the guest speaker for this afternoon. Before we get started, I'd like to mention that this webinar is brought to you by the Bruyère CLRI. The Ontario CLRIs, Bruyère, Baycrest, and Schlegel, enhance the quality of care in the long-term care sector through education, research, innovation, evidence-based service delivery, and knowledge transfer. They are supported with funding from the Government of Ontario. And they are who reached out to Family Councils Ontario regarding this session. So before we get started, I'd like to express my appreciation to the centers and to Bruyère for hosting the webinar this afternoon. So this is the Supporting Families in Long-Term Care Results from a Research Project webinar. A couple key points about logistics before we get into the content. In order to preserve the integrity of the audio, all the attendees are in listen-only mode, which means that you're muted. So while hopefully you can hear me, I can't hear you. In order to communicate with the organizers or to send questions to me, we're going to encourage you to use the GoToWebinar question chat box feature. So any typed messages will be sent directly to the organizers, and I'll receive the questions that you'd like me to address or respond to during the Q&A session at the end of my presentation. So I'm going to go through our content and then also leave lots of time to address any questions that you have about this research project and next steps for how together we can implement perhaps some of the ideas that have arisen from this project. So I'm going to tell you a little bit about the project, the key findings, really what the bottom line is that arose from what we heard, next steps, so how we can work together to perhaps improve the delivery of social work and social service work services for families, and then wrap up with a Q&A. So I'm from Family Councils Ontario, and our mission is to lead and support families in improving quality of life in long-term care. And our vision is really that people, so everyone in long-term care, residents, families, staff, and so on, have a vibrant experience, and for residents, it's the best care possible. And we do this by working collaboratively with our partners within the long-term care and broader health and seniors sectors to cultivate effective family councils, advance public policy and system planning, and to mobilize knowledge exchange. And this project, which is about the availability and offerings of social service supports for families in long-term care, really relates to not only how to cultivate effective councils, but more broadly about supporting families in their role as caregivers and as partners with the long-term care home and the long-term care sector. And it's also, we hope, going to be able to advance system planning throughout the sector. And this session is to mobilize knowledge exchange so that we can get the word out about this project. We are very grateful to the families, caregivers, and sector professionals who took the time to participate in the project. So without them sharing their experiences, insights, and reflections, the project wouldn't have been possible. And another acknowledgement that I'd like to make as the project manager for this was our lead researcher, who was a placement student with us at the time, Olivia Sarek. And she came to us from Ryerson and started some of this work during her placement, and then was able to finish it with us as a special projects coordinator. So in a way, I'm piggybacking on all the work that she has done, and I must say it is fantastic work. So not only do we express our gratitude to the participants for the project, but also Olivia for her work. This project was launched in November of last year, 2017, and it actually arose from a conversation between myself and a social worker at a long-term care home. And she expressed that much of her work was actually being done with families, counseling them, less so residents. And her concern was that she wanted to be able to do the work with families to the best of her ability, but was feeling constrained. And then we started to hear more about this from both service providers and caregivers about the availability of social work and social service work supports for the families. So as we started to hear more and more from caregivers and long-term care staff about their experiences, we decided we really needed to capture those experiences to better understand the role, functioning, and impact these services have on families. And we're going to specifically focus on social work and social service workers and their role in long-term care. So we developed a two-phase project. Phase one was high-level data collection. So it was surveys to social service providers working in long-term care or with previous professional experience in long-term care, and then also to family members and caregivers of residents. So there were two different surveys that were developed that were aiming to capture similar responses of experiences. So looking not only at the caregiver experience, but the provider experience as well. So these surveys aim to capture data on what's actually happening in long-term care, so the existing social work and social service work services and supports available, but also the effectiveness and impact of these services and family satisfaction with them. And for service providers, we wanted to capture their experiences, so what they felt worked well and didn't in their role and their work. Phase two really built on phase one. So phase two, we invited participants in the initial surveys to do more in-depth interviews. So those were interviews with families, caregivers, and the service providers. And we did this to get a deeper dive and really understand their experiences and perspectives. So we wanted more qualitative feedback on services provided, the impact of those, so actually hearing stories from family caregivers and service providers about the impacts, challenges, and ideas about changes to improve those services. And what we really found through the interviews and through the surveys was that there's a lot of really great work being done in the sector and in the perspectives of both family members and service providers, room for improvement. So those are a few key messages that we heard that I'll get a little bit more into later on. So we tried to get as great a reach as possible through both the surveys and then the interviews. So the surveys were an open invitation to participate. The only criteria were being for the service providers working in long-term care or previous experience as a social worker or social service worker. For families, it was having a loved one in long-term care, now or in the past. So it was an open invitation to participate. It was a mix of open and closed-ended questions in order to get both some ranking and some qualitative feedback about what works well and what doesn't. And we did as much outreach as possible. So went out through our website, our e-bulletin, and so on, social media. The interviews were stage two. It was phase two. And that was a follow-up from the survey. So the survey asked for participants if they wanted to participate in the next step, so in a more in-depth interview. And so that was done by phone, and they used predetermined but open-ended questions. So interview guides were developed so that they would be semi-structured interviews that allowed for both getting the information that we really wanted, but also to flesh out those complex experiences of both family caregivers and service providers. And this methodology really sought to capture an accurate understanding of those unique experiences of receiving or providing care. And it allowed us to ask more in-depth, open-ended questions that remained unanswered from the more closed-ended survey methodology. So we had, from the surveys, 32 family members or caregivers that responded and 21 service providers. From those surveys, 10 family caregivers and 5 service providers stepped forward to express interest in being interviewed. So, of course, the limitation of a survey like this, a research project like this, is people self-identify as being interested, but also we have a somewhat small response rate. So it's not something that we can necessarily extrapolate to being representative of every family or caregiver or service provider or long-term care home, but we did find a lot of consistency in the responses, both within the surveys and the interviews, that can provide us with some key learnings that we can use to help advance the experiences and the impacts. So for those interviews, we also developed an interview guide that had a consistent format, but that also allowed those participants, those family member caregivers, and those service providers to lead the discussion, to really share their experiences and their insights, which helped to develop a more natural conversation. And so through that, we were able to get some really rich data. Now, the interviews all took about 40 minutes to complete, and they were done over the phone. And then to get at these key findings I'm going to discuss, we did qualitative analysis throughout the interview process to identify some thematic consistencies. Now, the themes and patterns that emerged in the interviews were further reviewed and looked at with regards to these surveys. And the most prevalent and salient themes are what we have as our key findings. So I'm going to start with the family perspective and then move on to the staff perspective. So as I do that, I'd like you to reflect on your own experiences. So if there's something that really resonates with you, then we'd love to hear about that either at the end through the Q&A session or follow up by email with us. Because part of the next steps for this project is hearing from you and seeing what we can do together to move this work forward. So starting with the family perspective, what we heard and what we've heard in the past beyond this project is that families are feeling a lack of transitional support. And we hear time and time again, and what came through so clearly in this research project is that the transition to long-term care is heartbreaking. That even when families know that it is the right choice for their loved one based on their care needs, wishes, and preferences, it's still not really a choice. It's not something that people get excited about. It's difficult. It can be emotionally and physically draining. And while families have a range of feelings from grief and guilt and so on, there's other feelings mixed up in that which create a burden on folks. So perhaps feeling relief, that can be a complex feeling. Now, families also told us that while this is a really challenging time where they need that support, they're not receiving it. So the support for families, what we heard was that it's crucial and necessary, but that not a lot of it was being delivered. But when those services were provided, it had a huge impact. Now, the support varied from home to home and family experience to experience, but the families who did get that support right at the get-go had a much better experience. They described better experiences transitioning to care. They felt that there was someone, a professional, who was able to guide them through the initial phases and really into the home community. Now, families who were unaware of a social worker or social service worker or received no transitional support really described their transition as distressing, difficult, and unsupportive. Now, social workers and social service workers play an integral role in the transition phase because they have those professional skills. And the support varied, but those who did find a supportive and accommodating staff had a much better experience. Now, we also found that families really expressed a need for increased education. And not only throughout the admission process, so admission meeting or tour of the home, but also throughout the stay in long-term care. So families wanted to know more about the resident experience, about things that their resident would be going through, because seeing your loved one in distress often increases your own stress and anxiety. So that goes back to the transitional support, but it also relates to looking for increased education. Families mentioned that they didn't feel well equipped to handle the reality of long-term care, that it's a really complicated system, and that families want more information on home policies, staff, procedures, resources, and supports available to them. That they really wanted to stay informed and have the homes involved in providing that education and information. Some families weren't even aware that there was a social worker or social service worker available in the home. One quote that we heard was that, "I didn't know what the role of a social worker was in long-term care. In the 11 years that I was in long-term care, I had never seen the social worker." So in 11 years, they weren't even aware that this support was available to them. And think back to that transition to long-term care. It's a crucial and necessary service, but families felt overwhelmed. But when they had that support, they had the support of a professional to help guide them, they had a much better experience. So think about throughout a resident's journey in long-term care and that family going with them throughout that process. Families really do have a desire for that education, because they felt that social workers and social service workers were excellent guides or educators throughout that process. Personal support workers and nurses are often unable to provide the time to do that education and resources to families because, it makes perfect sense, they're focused on delivering care to residents. But the folks who are best positioned and best suited to act as a guide and educator are social workers. They're the key players when it comes to educating, informing, and keeping the lines of communication open. And families really want social workers to provide that service, that they're often the gatekeepers of information and can act as valuable sources of information and a liaison between the families and the home. Specifically, families wanted to know more about Alzheimer's and dementia, palliative care, legislative changes, and so on. All things which help them be better caregivers and better partners with the long-term care home. And to do that, they felt that the social worker or social service worker was the best person to help with that. They also wanted just more contact. What we heard from families was that they had little contact with a social worker beyond a crisis. And the reality of long-term care often meant for them that few social work or social service work services exist beyond emergencies, and that families felt unheard. One family member quite candidly said, "I didn't feel like anyone was listening to me." And that's a very isolating feeling. It means that who do you go to when it feels like everything's weighing on you, or when you're unsure of what a change in a health condition means for your person, for your resident. So families need to be heard, and they want that increased contact. Families who got that regular care and contact found that it had a hugely positive impact on their residents and themselves. Families who were able to connect with a social worker or social service worker accessed counseling services, support groups, workshops, and other formal and informal supports. Not necessarily things that were delivered by the social worker or social service worker, but that person was able to act as a linkage or a broker to access those services. And these services actually help those families better support their residents and manage caregiver burnout. So once again, having that contact with a social worker meant that they could be better partners and better caregivers. They felt they had increased confidence in the home and that they had someone on their side. So just having contact and having a social worker act as a link to other services helped create better caregivers and better care partners with the long-term care home. And that's something we all want. We want families to be engaged in long-term care, and we want them to be knowledgeable and supported. And they felt that the social worker and social service workers were an essential support for doing so. So we saw and heard that people really want this, and it has a very strong impact on those folks who received it. We also heard that families come into the home with excellent knowledge about their resident. Many families act as caregivers for years and years before their resident moves into long-term care. They understand that person like no one else does. So while families recognize that long-term care is a more institutional setting, they felt that homes could do a better job at listening and recognizing to the expertise of families, because they are the ones who often have that incredibly valuable insight that allow homes to provide better care for those residents. And the social workers and social service workers often acted as an intermediary between families and other staff. They were able to connect them to the appropriate staff people for getting more information or sharing information. And they were also able to spend time listening to the needs of families and advocating to facilitate positive change. Because social workers and social service workers are trained in this, in counseling, in information and referral, and so on, they were thought to be the best suited for doing that work. And further, we heard that families really are an important piece in the long-term care puzzle. It's actually detrimental to ignore their experiences. So respondents wanted a more collaborative relationship between service providers and themselves. And when they were able to do that, they were able to provide meaningful feedback and contribute to solving care issues, which would improve the quality of care provided to their residents. One family member said, "Every home would benefit from a social worker. They're looking after our loved ones, but they need to be aware that there's a family component to this. When I go home at night, I want to feel that my mom is in good care." That's a common family experience. And as we heard earlier, when families do receive the support from a social worker through the transition period and beyond, they had much greater faith in the long-term care home because they felt supported and they felt connected. They had increased confidence, which meant that when they did go home at night, they did feel that their person was well taken care of. So these are the most common themes that we heard from families throughout this research project. Now we're going to shift focus a bit and talk about the staff perspective. So the key findings that we heard from social workers and social service workers. Some of it's going to be similar to what we heard from families. A lot of it is complementary. And what we heard from them, in some cases, is a bit different from their different perspective. So we heard that social workers and social service workers were wearing many hats and juggling a variety of roles and responsibilities. Respondents actually described their role a bit differently. So not every experience of working in long-term care as a social worker or social service worker was the same. They also found that their roles lacked definition and that their time was actually being spent on non-social work or social service work duties and responsibilities. So while most worked on admissions, the similarities in role really ended there. They often had complicated and large workloads, which meant that they didn't have a lot of time to make necessary connections with family members. They actually felt that their time could be better used directly supporting residents and their families. One social worker commented, "I can't reach every resident. I don't really see residents that don't need it, social work. I'm only there when a crisis occurs and we're putting out fires. We're not solving care issues, just managing them." And another social worker noted that because the role lacked consistency, that's why she didn't have the time to make those connections. Another spoke of frustration and not being available for families and residents. Now, what we also found is that the role actually varied quite a bit within the home and more broadly within the field of long-term care. So respondents had different professional designations, competencies, skill sets, and even job descriptions. So one person noted that the lack of consistency really made it difficult to ensure a standard of care for all residents and families who receive the social work and social service work supports. And interviewees really felt that a more defined role would allow them to address more of the needs that match the needs of their, more services that match the needs of their clients. And they really wanted to be able to share and use their professional skill set appropriately within long-term care. Social workers and social service workers receive, by and large, very high quality education and have excellent skills that make them well suited to working with families and residents who are in crisis, but also to support them throughout their journey and to provide increased contact, to listen to them and help them work towards positive change and to be more educated. But they felt that they weren't able to do that work within the current system. Specifically, we heard very strongly that they felt that the long-term care legislation meant that their roles lacked clarity. Because they're not a mandated role, it made it difficult for them. Now, they felt that having social work in long-term care really helps ensure high quality of life for residents and strong, confident relationships with families. Really help to advance culture change and really a customer service mentality. Now, this isn't something that we can, of course, change ourselves, but what we did hear from respondents is they'd be interested in exploring what legislation would mean for their role in long-term care, specifically for more individual connection and support, given just how important and valuable it is for the long-term care home and its residents and families. And they really felt that without their support, the quality in homes would decline because they're often that liaison between families and staff in order to support having care providers know more about the residents they're caring for and with. So they really wanted a desire, they expressed a desire to have a social worker or social service worker in every long-term care home. So that's something that we would need to explore as a sector for next steps, what it would mean to have mandated roles to have greater clarity and definition of the social worker and social service worker role in long-term care? And would legislation mean more individual connection and support? That's something as a sector we really could spend some time exploring to better address the needs of families and residents. Service providers also saw themselves as one part in the puzzle. They thought that family members received minimal supports in long-term care. So once again, this is what we heard from service providers. Some felt that families are ignored in long-term care homes, and that increased collaboration with families, so having them as one part of that puzzle, along with residents, social workers, and other staff, is really what we need to foster a trusting and safe environment in long-term care. And specifically that they would like to see long-term care homes invest in social services that involve support groups, counseling services, educational workshops, transitional support, and for them to have the increased capacity to do more outreach. But unfortunately, they felt that their resources were lacking and they were unable to meet the needs of clients. One social worker described it as always having to play catch up. So they wanted to make meaningful connections with families, but they weren't always able to. So service providers were aware of the gaps in their service, but they felt that under the current restraints of their roles, they were unable to actually provide that services that they wanted to. They want to make meaningful connections with families and provide really well-rounded support to every family involved in long-term care. So to be able to educate families, to connect them with services and supports outside of the home, whether it's Parkinson's or Alzheimer's or something disease specific, or self-care, or anything else, social service workers and social workers really wanted to do that. They have the professional knowledge and skills to work with families in long-term care. But they felt that, try their hardest, their work is still underfunded and not fully acknowledged within the sector. And I think we're really on the cusp of moving this forward, in part because of what we heard from families and residents, that they really do see a strong need for this to be more available. And they're also quite willing to take on more work, provided that they're actually able to do so within their long-term care homes. So those are the main themes that we heard from staff, so from social workers and social service workers. Now, of course, it's what do we do next? This is great work, and we heard things that we were expecting, but also things that we weren't quite expecting. So we appreciate and acknowledge that folks were very forthcoming in sharing their experiences and their perspectives through this research project. So what's the bottom line? Both family caregivers and social workers, social service workers, believe that those services are integral to supporting families and residents. They also both felt that changes can and should be made to improve the availability and offerings of those services. Now, we know that budgets are limited, but if we can start taking small steps towards implementing some of these recommendations, it will improve the staff and family experience. So we know we can't solve this all in one day, but if we start having discussions about what this can look like for families and residents, we can start moving those goalposts. We can start taking strides towards improving the support and availability of social work and social service work services in long-term care homes. Now, families also shared many experiences that showcased excellent care delivered by dedicated service providers. They shared ways in which providers worked creatively with families to solve problems, direct resident care, and to problem solve. But they really highlighted the need for those compassionate and dignified approaches, and that they wanted family-oriented supports to be taken seriously in long-term care. And part of that needs to go with open dialogue and increased communication between providers and families. So it wasn't all frustration. It was also, we heard a lot of wonderful stories about what's working well. So social workers, social service workers, and families can highlight areas of improvement within those practices in relation to working with families. So if we start taking small steps around increasing education, support work, and communications, we can make real progress in improving the family and resident experience and the staff experience with specific regard to social work and social service workers. Now, families care very deeply about their residents, and they want to work with home professionals to improve care. They're deeply invested through their involvement in initiatives like quality improvement and family councils, and often so are staff. Staff, what we heard from them, the service providers, is that they are deeply invested in the long-term care sector and in caring and working with families and residents. So they really want to do this work, to take it to the next level. So how do we do that? We don't have all the answers, but we have some ideas for next steps that you can take and that we can take together to advance this work. So do information gathering. So talk to your administrator about what are the social work and social service work services available in your home. What do those services look like? And what are the responses to those of your home? What do other homes do? You know, perhaps it's connecting with other family members, family council members, or long-term care home staff to see what works in their home. So get some information. Start discussions about the benefits that you found for social work and social service work services. What impacts do those have on families? Start asking questions about how can you help support access to and the availability of those services? So what are the ways to move forward to make social work and social service work services more broadly available and to make them meet the needs of those families and to really utilize the skills and experience and knowledge of those service providers? So start those discussions and then see how you can create change. So tell us what you found useful. Get in touch with us. We want to continue advancing this work. In order to do that, we need to hear from you. Tell us what you found works well or not. Help us gather information and data on how social work and social service work services operate in your homes and can be improved. Reach out to social work and social service work students in your area to talk about long-term care. We need to, as a sector, work hard on making long-term care seen as an employer of choice. What we heard from social workers who were working in long-term care through this project is that they love their work, that they're doing this because they care deeply about the experiences of residents and their families, that they have a real difference to make. We need to share that with up-and-coming workers. And so part of that is what you can do. So talk to your home, talk to your families, get information, and then share with long-term care students who are going to be working in the sector about why long-term care is a fantastic place to work. That's how we can create change. We can do that at a systems level. So please do tell us so that we can take your comments, your ideas, your challenges and suggestions to system planning partners so that we can help to advance this work, but also think of the ways that you can make a difference in your local community, in your home. So talking to your administrator, talking to families, and reaching out to folks in the community to help advance this work. So these are our ideas for next steps. And if you have comments about how you'd like to advance this work, please do share those with us. And I've seen that I'm getting some comments sent in as well. So I'm going to shift over to the Q&A section of this presentation. So I want to hear from you about your comments, your questions, your thoughts, anything that really resonated with you from the results of this project, or anything that an experience you'd like to share. So I'm going to start with the first comment that has come in. My dad has been in long-term care almost 3 years, and I still don't know who is a social worker, social service worker at his home. Our family feels we have the ear of the Associate Director of Care, who is an RPN, so we do feel heard, but she is so busy. Maybe it would be better to have a social worker, social service worker, or maybe she's also trained in that. It can be frustrating sometimes, but I will investigate that at my dad's home. And that's a common experience that we heard, that staff do provide excellent care and they are open to hearing from families, but they're often quite busy. And that social workers and social service workers are folks who receive lots of training on counseling, active listening, information referral, and so on, who can really work with families. So this was not meant to dismiss the hard work of other home staff who do work tirelessly to support residents and families, but more to acknowledge that we can do better, that we can utilize the very dedicated and knowledgeable and skilled folks, social workers and social service workers, to support families. Okay. Next question. So thank you for sharing that experience, and I do hope that you'll be able to go back to your long-term care home and start having those discussions about possibilities for doing better and for engaging social workers and social service workers in supporting residents and families. Next question. Beyond supporting families, residents through admission transition time and intervening during crises, what other types of responsibilities did the social workers and social service workers describe in long-term care? So those were the biggest pieces of feedback that we heard. We also heard that often social workers were doing work that was administrative in nature. So they often were helping with paperwork and so on and so forth. So less direct care and more administrative duties. So it was a lot of non-social work and social service work that they were doing. The biggest one we heard, other than putting out fires and crises and transition, was administrative work. So thank you for that question. If there's any social workers or social service workers on the line who'd like to share more about their work, we'd love to hear from you as well. What percentage of long-term care homes in Ontario have social workers or social service workers? That is hard to answer. We don't actually have a firm number on that. So all the service providers we heard from were working in a home with long-term care, but I can't say how representative that was of the sector as a whole. So what is FCO doing to advance this, to look at making social workers mandatory and defined? This is the beginning of that. So this is stage one. And in order to help us do that work, we need to hear from you. So our role as an organization is to do system planning. And it's one of our roles as an organization, is to bring forth your questions and your concerns. So that's what we're doing. We are striving to hear from as many people as possible so that when we have more data, we are going to be able to bring this to our system planning partners, including, the CLRIs are a great partner for advancing this work as well. That's why we are working together for this webinar, and hopefully for future work. And other system partners like the Ministry of Health and Long-Term Care, we're eager to share the updates and what we've learned from this as well. So we act as often a liaison or a link between grassroots experiences, so the experiences that we gathered throughout this work, and the system planning. So we are going to continue to reach out and look for more information on this subject and bring it to our system planning partners to explore ways that we can do better. Thank you for that question. Next comment, this is great and important work, thank you, to promote the need of services in long-term care. We just had a loved one moved into a home last month. What we expected is more what we can do. So here's what we're hearing from families about what you can do to support your loved ones. So if you're looking for that from your long-term care home, one step is absolutely go to your family council. So family councils provide excellent information on how you can support your loved ones, what you should and shouldn't do, pay attention to, monitor, and so on. So that's the role of a family council. Your social worker, if you have one, can help you to access the family council to provide you with access to other supports in your community and in your long-term care home. So I'd say if you're looking for more support on the role of a family caregiver in this new setting, reach out to your family council. Because family councils are based on a peer support model, they have excellent insight on how their roles have evolved as family caregivers and what you can do to help promote the quality of life and care of your people in long-term care. So thank you. So reach out to your council, reach out to your administrator and your social worker. So unsurprised by the findings, all of it resonates with me as a social worker in long-term care. So thank you for sharing that. And if you're comfortable reaching out to discuss this work in more detail, we'd love to hear from you so that we can continue this. And we do need to hear from folks who were involved in the research project, but also if you weren't and you want to discuss this in more detail, please do get in touch, because we do need to hear when it resonates with you and when you've had a different experience. So thank you for that feedback. Long-term care home that did a presentation to social service workers at a college. That's fantastic. That's how we're going to be able to reach out to the next cohort of social workers and social service workers and the folks who are thinking about their careers now. We need to share the reality of long-term care, and that service providers like social workers and social service workers can make a huge impact in people's lives, and that long-term care is a place to do it. So thank you. I am so glad to hear that. If others have had similar experiences, please let us know how that's worked, how you went about doing that, because then we can share this more broadly with family councils and long-term care homes in the province. So we can also help to collect those best practices and those suggestions to share them broadly. So thank you for sharing that, and we will be taking that forward as an example of a way to make a difference and advance this work. Another comment that they're not sure have a social worker. Have a family council meeting tonight and we'll ask the administrator. Excellent. That's one way to start. And if there isn't a social worker, you can start to explore why. It could be an issue of funding or what have you. So have a gentle conversation about what this looks like and what's the potential for engaging with social work and social service work. And you can talk about how it's so valuable within long-term care. So how is the service funded in long-term care? That you need to ask your administrator specifically about how what funding envelope it would be coming out of. Are there community social workers that we can suggest to families? Often our resident family service staff in long-term care do not have a social work designation. One suggestion I would have is to reach out to local organizations such as the Alzheimer's Society. Often they will have social workers who would be able to provide some services. some counseling to folks experiencing or caring for someone with Alzheimer's or dementia. So I'd start there and ask and explore what other community organizations are out there. So there definitely are options. The Alzheimer's Society is one that I know of. All right, great question. Is there any home that delivers a short course, program, or focused in-service for families of new residents? I know there are many that have welcoming, orientation, meet and greet that are social in nature, but not necessarily providing a deeper or meaningful understanding of what about to embark on as a family member. I'm not aware of one that has done that in quite that way. However, it's something that if any of you folks on the line are aware of being done, please share that with us so that way we can get the information out there about what that looks like. It's a great idea for providing that support, that education, and that service to families so that they can be even better caregivers and work in collaboration with the home. We do not have a social worker. What would you suggest? So I would suggest starting by talking to your administrator about if there are social work or social service work services available, looking at what other homes do, and ask, so why don't we have one? And then ask how you can help support the access and availability of that. So talk about how meaningful and important it is to have a social worker or social service worker, talk about the benefits and so on. So they're not required in the legislation. So to answer the next question, but I would start to have conversations if you don't have one, a social worker or social service worker, with your administrator about why and what are the possibilities for doing that. So how are we going to help advocate for next steps? So we're going to start to explore in more detail the experiences of social workers, social service workers, and families. I don't know that legislation is the best answer. That's something we need to explore in greater detail from a policy benefit and implementation standpoint. I can't say for sure, but that is why we want to hear from you. So tell us what you have found works and what you see as opportunities for improvement. Okay, great comment from a social worker in long-term care who says they spend their days doing admissions, touring individuals, facilitating care conferences, assisting with palliative care, dealing with crisis, monitoring and reviewing referrals to add to the wait list, facilitating family councils, supporting families and staff. There are not enough hours in a day or a week, and I'm a contracted employee. Social work needs to be regarded as a very important role in long-term care, and I would argue that we need more than one social worker in some of the larger homes. That is a huge workload, and that's something that we did hear from social workers and social service workers in the survey as well, that they have a huge workload and there simply isn't enough time in the day to be able to do everything that they want to. So it's a matter, they prioritize what they can do. And I agree, social work does need to be regarded as an important role in long-term care. It has incredible opportunity to change the lives of residents and families. And really, we do need to utilize the skill, knowledge, and experience that social workers and social service workers bring to the long-term care sector. So thank you for sharing that. Okay. Next. Okay, registered social worker working in long-term care. Some of duties included, like we talked about, reading applications for people into the home, attending interdisciplinary meetings regarding resident behavior, care plans, care plan review meetings, everything in between. They also, in this person's experience, fill out paperwork for residents regarding disability or other subsidies, referral forms for dentistry and arranging transportation. They also engage in policy review and creation, attend and facilitate council meetings, and then anything and everything in between, and resident care as well. Again, it's all too real and our workloads are huge. So so thank you for sharing that. And that's something that we definitely heard from all of the respondents, that social workers and social service workers work very hard and have huge workloads, and that they try their best to do as much as possible, but it simply isn't always possible. Okay, another comment that the webinar has made me so appreciative of the effective role that the social worker plays at the long-term care home where my dad lived for 5 years and my mom continues to live in her 8th year of residency. One very significant strategy is that the social worker is the first face that any family member meets. The social worker leads the tours for families searching for a home, so right from square one, a connection is started. So that's fantastic feedback, because it highlights that when you have that connection right at the beginning, families are more likely to know who to connect with when they are experiencing challenges or they're looking to gain some support. Another response, I feel like every social worker role looks different depending on the organization and the home's expectations. So that is something that we heard as well. There was actually a comment from a social worker that said, our profession is misunderstood. I had one administrator tell me that it was a luxury to have. I saw my role as a necessity. So that really, I think, highlights that there are different expectations of leadership and social work, social service workers. This person also commented, funding for my home comes out of the recreation support programs budget. I think that's the norm. So it's also about setting those priorities given limited funding. Another response, there are many long-term care homes in my region, but I'm only aware of one other home with a social worker on staff. I hear from families all the time how great it is to have me available and how they wish every home had social workers and the benefits of my role. And I think that is true across the province. What we heard is that family members who had access to a social worker or social service worker, that they had a much better experience and that they were able to be even better caregivers and partners with the long-term care home. So I think it'd be true to extrapolate that comment to many others, that families and social workers do wish that every home had that available. Another comment, the social worker in our home are many committees, palliative care committee, and often act as a staff assistant for resident and family councils, along with transitional support and previously mentioned roles. We often do find about that it's often the social workers or someone with a similar role who facilitate or support the family and residence councils. I really like the question about a course for new families. Do you think this could be a subcommittee of the family council, meet new families individually, explain what we do so they informed before they come to their first meeting and maybe less intimidating? I think that's an excellent opportunity to discuss with your council about looking at the needs of families through that transition and how family council can play a more active role. So I would say have a conversation with your council. Talk about what we explored here today and how your council can help to address some of that. So I would say it's an excellent idea. Next comment, so I have time, I think I'm gonna wrap up with the last few, but please do get in touch with me by email if you have anything else that you'd like to discuss or bring forward. Thank you for highlighting the work of social workers and social service workers in long-term care. I'd say you're welcome. Given the turnover we're experiencing, death and admissions, it has been impossible to meet everyone and make connections with residents and families. I am beginning to put together an educational program for new admissions to offer in a group format. Great to hear that would be welcomed. I think that's fantastic. And if you're open to sharing and discussing that with me, I would love to hear from you, because it's something that we could suggest to more sector partners as something that's necessary and welcome. So please do get in touch. So another home that had a social service worker who takes care of care conferences, resident support, family support, and palliative care. They are also a social service worker who takes care of admissions. So they take the time to support the family prior to, during, and post-admission. And it's wonderful to be able to support families post-admission and check in with them the day after to let them know, to ask how the first 24 hours have been, and to let them know. Families find that provides them with a peace of mind. And the data presented has been a great eye-opener to the importance of social work and social service workers in long-term care. Thank you for those experiences. So it is, I have 1 o'clock right now. So I'm going to finish with just one final question or comment, and that goes back to making a difference in the broader sector. It says, as a long-term care home, we do get social work students to do their placements with us, which is definitely a great way to share with students how our roles work in long-term care and hopefully get them interested in it. That is fantastic, and I wish all of you all the luck and offering of the support that we can give you about doing that, about making a difference and reaching out to folks who are coming into long-term care as staff and who are going to help really advance this work and bring their skills and expertise to residents and families. So I wasn't able to get to all of the comments or questions, which thank you so much for all of your participation and engagement in this work. This is only one step in supporting this and in moving this forward. So if you are someone who has experiences to share, questions to ask, projects or ideas on the go, please get in touch. We would love to hear from you as we move this forward. So my email address is there, just spac@fco.ngo. Please do get in touch. And you can also follow us on Facebook, check out our website, or give us a call, because this is something that we're really excited about and see it having a huge impact on the lives of residents and families, of ensuring that they have a vibrant experience and fantastic care, and supporting the tireless work that social workers and social service workers do to achieve those goals. So I'm going to give a final thank you to the Bruyère CLRI and the organizers, Emily and Michaela. Thank you very much for your support and for helping to promote this session. And I look forward to connecting with all of you folks down the road. On that note, I'm going to sign off and have a wonderful rest of your day. Goodbye.